We love stories about medical breakthroughs, especially when they happen here in this medical community where we're blessed to live. And this one is a big deal for technology. The first robotic surgery on a pediatric patient at MCG in the Children's Hospital of Georgia. The surgeon was dealing with obstruction that caused swelling in a 3-year-old's kidney.
As we were saying before, this is how the swelling was. And you can see how it goes all the way out to what we call the minor calyces, through the major calyces. And now we see it over here. It's a lot better.
Dr. Brad Morgenstern is an associate professor of pediatric urology at the Medical College of Georgia at Augusta University. And it is so great to have you here today on the broadcast. Thanks for your time.
Thank you so much for having me here. Really
Now,
appreciate it.
Well, this was exciting because, of course, we've heard of different robotic procedures, but this was unique because it was on a child.
Yes, ma'am. It's a 3-year-old child. She had had a urinary tract infection. That's how we got the ultrasound, that we noticed there was a blockage on the kidney, and through some other more fancy tests, something called a renal scan, that shows us how the functioning is working, and if it's obstructed, showed an obstruction. So you have a couple different methods that you can go in to relieve this obstruction. One could be a big open surgery with, on a 3-year-old, can be an incision about this big. Whereas the way we did it on a robotic surgery, we get 4 incisions, just about the size of my pinky. And that's the way I show people.
Right. The little Band-Aid,
Yeah, that's all you need, just one little Band-Aid.
We call them. Yeah, you just,
this is it. And it heals very beautifully.
It's fantastic. We do have some video to show you while we're talking of Dr. Morgenstern in a follow-up visit with the patient. I would think that when you're dealing with somebody that young, so much of their mindset has to do with the relationship they have with you.
That's fun. I mean, that's one of the reasons why I went into pediatrics, is because I get to walk in the room and be goofy and silly and happy and play with these kids, you know, and it's just so rewarding when you can go in and you can do a surgery like this and just fix them and just really know that you've done something good for the rest of their lives. And it's just really rewarding that way for me.
Well, isn't that a tremendous way to look at this? You've done something for her at age 3 that will benefit her the rest of her life.
It's one of the reasons why I do it. It's really beneficial for me. It just makes me feel good that I've really helped this person for the rest of their life. Now, when we do the surgery, we do the surgery so that she doesn't lose function of the kidney. And something important for people to realize if they're having this condition is the surgery doesn't give you back function. This is just something happened innately. It was no one's fault. It wasn't her fault. It wasn't something in her genetics that we know of now.
Yeah, so it wasn't a congenital thing.
It is a congenital thing.
Okay.
So that's why I say that her function, some of these kids will have function lost because of the obstruction. Her case was fortunate that it wasn't too bad. But what you do is you do this so it doesn't get worse. Because that pressure that builds up behind this blockage, this tight blockage, is what causes the function to go down.
Okay.
So we do that
and so
to
then
prevent
that's
that.
really important, because as she grows, her organs are going to grow too.
Yes, ma'am. That's
Okay.
exactly the thought of trying to get it earlier. Now, some of these do go away, but by the age of 3, if you're still seeing it, the likelihood of it going away is very low, and they can have loss of kidney over time.
Oh, no, don't want that.
No, ma'am.
No.
Fortunately, you have 2. That's one of the fortunate things of being a urologist. A lot of us we have paired organs, but you don't want that. God forbid something happened to the other one, then you're dialysis and everything like that.
Well, we're going to talk to Abigail in a minute, but before we do that, she's not the only one. She was the first, but you've had more since then.
Yes, ma'am. I did a 14-year-old who about twice a month was having nausea and vomiting, and they thought that he had a GI bug, and finally it got so bad that they got a CAT scan, and it shows this big swollen kidney where he probably had a vessel that's been obstructing for some time, and it just took time for this to build up. Now, Abigail's obstruction is a little bit different. The tube coming out of the kidney, called the ureter, right where it meets what we call the pelvis, where the urine comes out of the kidney, was probably congenitally just small. It was letting something through, but not everything through.
Yeah.
That's a little different than his. He probably had a vessel sitting on top of it, which we found surgically, and that we unplug the tube underneath and put it above the vessel so it doesn't get blocked. And 3 months, I just saw him the other day, no more nausea, no more vomiting, not missing any school. Well, now he's in summer, but didn't miss any more school after that, and is a much happier kid.
It's interesting when I've seen video of robotic surgery, you're not right there over the patient. You're looking at a screen.
Yes, ma'am.
How do you think, I'm sure that you grew up as a kid playing video games and all, but what do you think that kind of manipulation does for you as a surgeon with robotics.
That's exactly right. I mean, I did grow up with Nintendo. Super Mario was my game back in the day. And just being able to look forward, know what your hands are doing below you, and just having that dexterity definitely benefited me. I'm also a drummer too. What people don't realize, robotic surgery, we actually have foot pedals too that we use. So you're using all 4 of your limbs in concert with itself. So drumming definitely helped me with that as well.
Sir, it absolutely does. My husband is a drummer.
Oh, nice.
And I am so amazed at how you can have one rhythm going here and something else going there. And I'm just thinking, how do you keep up with all of that? But it makes so much sense that that would play into your God-given talent as a surgeon.
Oh, it's a lot of fun.
That's
it's a lot
fantastic.
of fun. If it wasn't, I wouldn't be doing it.
Right. Right. Well, Dr. Morgenstern, thank you for sharing this information with us. I know a lot of people are going to want to know more about it. And stay right here, because still ahead on Jennie, we will hear from Dr. Morgenstern's young patient and her mother about the recovery process and how little Abigail is doing now. Stay with us. Welcome back, everyone. This is young Abigail, and I'm going to introduce you to her in just a moment. But for those of you just joining us, let me bring you up to speed. Pediatric surgeon and associate professor at the Medical College of Georgia, Dr. Brad Morgenstern, recently completed on this young lady the first robotic surgery on a pediatric patient there at the medical college. The patient, 3-year-old Abigail, had an obstruction causing her kidneys to swell since she was born. Since her surgery in January, Dr. Morgenstern has booked other pediatric patients for robotic surgery. And you have just seen Abigail and her mom, Emily, in the video. And Dr. Morgenstern is back, and we're so happy to have all of them here, and especially you, Abigail. Thank you for being here. She's very talkative. But you know what? She's a healthy little girl. And Emily, I know that this for you has been a very fascinating process to watch. Tell us a little bit about it.
It has. Before she was born, we knew that she might have to have surgery, and it was always kind of in the back of my mind. But doing it here with Dr. Morgenstern, it wasn't as difficult as I thought it was going to be, because like he said, she has the 4 small incisions, and she was back to her normal self within days after the surgery, and that's what I was worried about.
How do you prepare a little one for surgery?
I just kind of told her that they were going to go in and fix her kidneys, and she was okay with everything. Her older sister had more of an issue with it than she did, so.
But now, so her older sister is 9, so she would not have had the robotic surgery, right?
Well, she was more nervous about her sister going in for surgery.
I thought you meant she'd had the same procedure. No.
No, she was more nervous about her sister going in than Abigail was.
One of the things, the recovery must have been really interesting for you, because you were fortunate to have those little small incisions.
I was nervous about how to take care of them, but everything was fine. We had the Band-Aids on, and it was like she was back to herself within like 2 days. I was more nervous than she was too. I was like, don't jump, don't play, you can't do anything with the other kid.
So you are preparing a patient, and then you're also kind of holding the hand of the parent, right?
100%. I always tell parents afterwards, don't get gray hairs over this.
Yeah.
Don't worry. We've put our belts and suspenders on. We've taken all precautions. Watch out, but don't give yourself gray hairs over this.
That is very good advice, because as parents we can't help it. We are just we're going to be worrying about our kids. Was there any concern that she might like pick at anything or pull at the dressings?
I was nervous that she was going to do that, but it was just kind of, she just wanted to show it off to everybody. Anybody who would know, she wanted to show it off. And I did have a couple of moments where I was like, oh no, there's blood in her urine, is this normal? And I think I called the hospital at like 10 o'clock at night, and everyone was, very accommodating with my phone call. It wasn't like I was getting on anyone's nerves when I called, so I was very thankful for that, and they were very patient.
Right. Which is just so important when you have that medical team that's reassuring, and that they're letting you talk and ask questions and helping you understand. I find so much of the fear surrounding a procedure or anything like that is just that fear of the unknown. And once you get an understanding about it, then it just helps you cope, and then you're able to be strong for your child and all of that. But with such a quick recovery, my goodness, did you even stay in the hospital? Was it outpatient?
Overnight.
An
We
overnight
stayed
stay.
overnight, and we left about 6 o'clock the following day.
Wow.
So
And what was her eating and stuff like? Was she able?
she was ready to eat once she got out. She was ready to eat. They gave her popsicles, but she had chips and candy the whole time because that's what was available for her.
Well, that's really neat. That's a neat thing. I love hearing about the stories that impact children in such a positive way. We are lucky to have the Children's Hospital of Georgia here, and tell us just a little bit. This is a facility that brings people from way outside of our area.
Macon, we got people from Valdosta, Statesboro, South Carolina, everywhere. People will sometimes go around Atlanta to come visit us just because of the reputation that we have and the caring that we have for our patients. Also, not being the big city and the hub of the big city, people really appreciate that we're able to give that personable care. So I routinely have patients come for 4 or 5 hours away to come visit our hospital, which we're very fortunate to have.
The other thing that I really like about the Children's Hospital of Georgia is that partnership with the Ronald McDonald House. And when you have a family that is strapped, not just financially, but emotionally and everything else, for the families who don't live here, where they have somewhere to stay, where they can kind of recharge their batteries and somebody can take care of them a little bit. We're lucky to have that Ronald McDonald House. We truly are.
Yes, ma'am. It's a big benefit for the patients that we need multiple procedures on. You can't do them all in the same day, and the family can't necessarily afford a place around here, and it's right there on campus. It's beautiful rooms, food, everything. I'm very fortunate to have that and be able to offer that for my families that I work with.
Awesome. Well, y'all are so great to tell us about this today, and continued good health for young Abigail.
Yes.
And good job to you, Emily.
Thank you.
Thanks a lot. And Dr. Morgenstern, appreciate it. Coming up on Jennie.